2 patients who fled the main hospital in the city of Mbandaka earlier this week attended a prayer meeting with 50 people hours before they died. According to medical charity Doctors Without Borders, both patients were highly infectious. Meanwhile, another new case has been registered in the Congolese city. Health authorities believe it's linked to the epicenter of the epidemic, the village of Bikoro. At least 50 people have presented Ebola symptoms in the northwestern parts of the DRC. At least 27 deaths have been confirmed. Well, medical charity Doctors Without Borders say forced hospitalization is not the answer to controlling the Ebola outbreak. 3 patients left the Mbandaka hospital this week when their families demanded to take them to church. Ebola has no known cure, and isolation is the best way to keep the virus from spreading. Authorities have highlighted the importance of public awareness campaigns in containing the outbreak. Healthcare workers are trying to track down who the patients may have come into contact with after leaving Mbandaka Hospital. Right, for more on this, we're joined in studio by Charles Solo. He is the former East Africa Vice President of medical charity MSF. Charles, a great pleasure to have you in studio with us today. So we have another case of Ebola confirmed in the city of Mbandaka, another 50 people exposed to this virus at a church service. These are very worrying developments. What needs to be done to prevent further spread of this virus?
Generally, I know people are worried about what is going on, and at the DRC, we all understand, especially with the experiences, the past experiences of 2014-2015 outbreak, and Ebola is hemorrhagic. It spreads fast in touch, coming into touch with any kind of body fluid. So one of the things that will be key for the populations to know and for people to help in following up is that we are able to educate the communities in terms of what they need to do. Generally, Ebola, like the kind of approach that we take as a medical organization and all other people who are collaborating to ensure that this there'll be no further spread into this, we are looking at, we call it the 6-pillar approach, where we are looking at treatment of proper treatment of all the diagnosed patients. We are looking at a lot of outreaches into the community to look for the patients themselves. So it's not like any other ailments where you will wait for people in the hospital. So a lot of community outreaches needs to be done, and this is being done. And we also do what we call contact tracing, where we also find out who else could have been in contact with this particular patient. Then this also involves a lot of health promotion activities that to educate the communities and the people to know what are the risks that come with Ebola and what do they need to do in order to avoid these particular risks. Then there is the regular diseases that people may have. So a lot of support to the normal healthcare system so that they are able to access proper healthcare. And finally, as we know, Ebola is quite deadly. So with it comes some deaths will always be experienced. So again, working with the community to ensure that they understand what would be the proper ways of burial. We know this is something that at times is cultural, but at least working with the communities to understand that there should be some kind of protection during the handling of this. So we are looking at this as a situation that has come up, though as a medical organization and the facts that are coming from the ground, we want to tell the general public that we really don't need to be so much afraid. We really like the kind of collaboration and response that has come up this time around, because we are looking at an outbreak coming sometime around May 18th, and by May 21st already a lot on the ground, including vaccines and all that. So in Mbandaka specifically, what is being done now, MSF has been able to set up 2 treatment centers with 20 beds each. We are looking at isolation areas with, in Mbandaka Hospital and also in Bikoro. So already there are like 10 patients in Bikoro and 4 in Mbandaka in isolation.
Right.
Yes.
So allow me to take you back to, you talked about the vaccines, and in your opinion, Was it advisable to distribute experimental vaccines, and how effective are they likely to be?
Well, the Ebola vaccines are new. We remember these have been things that really, the experience that came from the 2014-2015 outbreak, people did not go back to sleep. There has been a lot of work on the background working on these very, very vaccines. I would say that confirmed scientifically, we are looking at around 75% effectiveness of the vaccines. But it's also important to mention that vaccine is just one of the tools in this intervention. I talked about the 6 key pillars that needs to be looked into, and for example, proper identification, proper contact tracing, and the aspect of isolation, which I know people, you know, it's not so easy to be separated with a loved one. So again, we are seriously working with local communities so that they are able to understand that apart from the vaccines that are available and are being given already, it is important to follow the normal infection control procedures, and also the health workers will continue working with protective gear as they. So all this combined with the vaccine, we are looking at a lot of good hope, and we are not so much afraid that this is far from being contained.
All right, Charles, we appreciate those insights. Thank you very much for your time.